and welcome to Standard Precautions and Beyond, Conversations in Infection Prevention and Control, a podcast of the Alabama Regional Center for Infection Prevention and Control, Training and Technical Assistance, or the ARC IPC. Alabama is a state known for its warm climate and beautiful landscapes, but it's also home to various mosquito-borne diseases that can pose a significant public health threat. And with spring right around the corner here in Alabama, the number of people participating in activities outdoors will increase, causing mosquito-borne diseases to be a significant concern for our community and for the nation. Mosquito-borne diseases, or vector-borne diseases, are transmitted to humans through the mosquito, or the vector, and have influenced human health and behavior throughout history. Some common examples you may have heard of include things like Zika or malaria, but there are others you may not have heard about that also pose a threat in Alabama. In this podcast, we will specifically be discussing mosquito-borne diseases and why people in Alabama should be concerned and take preventative measures against mosquitoes, especially during the spring and summer months. Joining us again today to discuss mosquito-borne diseases is Dr. Jonathan Rayner, Associate Professor in the Department of Microbiology and Immunology at the University of South Alabama's College of Medicine, and Director of their Laboratory of Infectious Diseases. Dr. Rayner received his PhD in microbiology at Colorado State University as a part of their arthropod-borne infectious diseases laboratory, where he studied factors influencing vector competence for yellow fever viruses and dengue viruses. He has completed 2 postdoctoral research programs with the American Society for Microbiology and the National Centers for Infectious Diseases at the Centers for Disease Control and Prevention. Dr. Rayner continues his work in the private sector in 2017 until he joined the University of South Alabama to direct their Laboratory of Infectious Diseases. Currently, Dr. Rayner focuses on assessing pathogen-host interactions and the re-emerging viruses as well as mosquito-borne infectious disease surveillance efforts that were initiated in 2018 under contract with the Mobile County Public Health Department. Thank you for joining us, Dr. Rayner.
Thank you for having me.
So, could you provide us a brief overview of what mosquito-borne diseases are and maybe some of the primary mosquito-borne diseases that residents in Alabama need to be aware of?
Certainly. So, mosquito-borne infectious diseases are those which are transmitted between vertebrate hosts by mosquito vectors. Predominantly viruses. In the United States, there's been a long history of mosquito-borne infectious diseases dating back to early settlements with things like yellow fever, and even here along the Gulf Coast. There were significant issues with yellow fever outbreaks associated with Aedes aegypti mosquitoes, as well as dengue and malaria.
And so just to understand, there are multiple types of mosquitoes as well, right, that can transmit these diseases?
Absolutely. Mosquitoes can be as diverse as people. Lots of different strains and species, some of which prefer to feed on, small vertebrates or birds, others that are more, anthropomorphic, wanting to feed on primates, people, for example. So not all mosquitoes are going to be of concern in public health simply because they don't feed on people. Others are going to be of greater concern because they predominantly feed on people. And then we have what are called bridging vectors, which are those that will feed on pretty much anything that walks. So anything from small vertebrates to even amphibians, reptiles, and then, of course, primates.
So how do seasonal changes in Alabama impact those different mosquitoes and that risk? Are there specific times of year when that risk is higher?
Certainly. When mosquitoes are more active, so your spring, summer, and even fall in Alabama can be significant. But because of our weather, the fact that we don't go through a lot of significant frost events, really there's the potential risk year-round in Alabama.
So something to definitely keep in mind. So since that risk is kind of always there, because you're right, it's warm very often, what are some steps that individuals can take to protect themselves from mosquitoes?
The predominant method is to ensure that mosquito breeding habitats around the house are kept at a minimum. These are like containers that may hold water any type of standing water can be a significant issue for breeding and propagation of mosquitoes. So if you have like a water feature at your house, like a little pond or a waterfall, something to that effect, either treating that water to eliminate the larvae and pupae that may hatch, or frequently emptying that and changing it for fresh water. Those types of things are really important. Other containers around your house that might collect water, so buckets, tires, a tire swing in your front yard is great. Poke a hole in the bottom so the water drains out. Those types of things.
That makes sense. Don't give them a place to lay eggs, essentially.
Exactly.
So, how have mosquito-borne illnesses affected communities in Alabama? Are there any particular regions that are more at risk, say maybe along the coast or swamp areas or places like that?
Yeah, those areas that where there's constantly standing water. So swampy areas, whether it's out of Dolphin Island and you see, the trenches that are constantly full of water. Right? Mm-hmm. Those are going to be hard to eliminate or even treat for that matter. So those areas tend to be at higher risk for propagating the mosquitoes and larger mosquito populations. And, if there's larger mosquito populations, then the risk for mosquito-borne infectious diseases is also higher. Luckily, in the continental United States, mosquito-borne infectious diseases are not of significant concern as they may have been once in the past. So I talked about historically, we've had really significant issues with yellow fever and dengue. We don't see a lot of that any longer, and that's predominantly because of efforts by our public health departments to monitor for the presence of the vectors and even the infectious diseases. And there are mosquito abatement programs that have been in place for quite some time that ultimately help to minimize the chances for those epidemics or outbreaks to occur.
What are some of those strategies to help curb those populations that are being done in Alabama?
As you mentioned at the beginning, I've been collaborating with Mobile County Health Department since 2018 when I first joined the University of South Alabama. They actually have a surveillance program, the Sentinel chicken surveillance program in place, where they put coops at various places throughout the county. They collect blood from the chickens every other week in a staggered way, and then they screen that blood for recent infection with selected viruses. They also have a mosquito collection program in place. They actually will bring those mosquitoes to us. We sort them by genus at the highest level, and then we will actually screen them using molecular methods for the presence of these viruses. That information then helps to direct their abatement programs. So as I mentioned, some of these areas in rural parts of Mobile where you may have standing water, when it gets to a certain level, a concentration of the vector, for example, or when they have, detected the presence of a virus, they will focus their abatement efforts in those regions to help, minimize the chance for human exposure and transmission.
Could you tell us more about any emerging or lesser known diseases or things that they've seen in those programs that they've had to address?
Yeah, the predominant concern, and we see, every other year, reported incidences of either West Nile virus or Eastern Equine Encephalitis virus. We monitor for those yearly. Positives, occur infrequently, but they do occur. We also look for St. Louis encephalitis virus, which we've not identified in any of the mosquito species here, as well as dengue, Zika, and chikungunya viruses. These are predominantly tropical viruses that require primate hosts for transmission. So it's less likely to see those in this area unless it's been introduced. Say a recent visitor, who had been to South America, or even some of these ships that come into the Port of Mobile, and they're bringing mosquitoes along with them.
Yeah.
That's always a possibility for introduction. But the risk tends to be significantly lower because of the abatement programs and the requirement for human transmission. Stuff like West Nile and Eastern Equine Encephalitis virus, they're actually maintained in a bird mosquito transmission cycle. So migratory birds can actually bring the virus into our region, and that can result in local infection of mosquito vectors. And then if those mosquito vectors also happen to feed on humans, then you have the risk for human transmission.
So I'm hearing it's an issue, but it's one where there are a lot of preventative measures that we can all take to help avoid spread, for sure.
Yeah, recent reports have shown an increase in arthropod-borne infectious diseases in the United States. But in the continental United States, that is predominantly attributed to tick-borne infectious diseases. And it's harder to control for those tick-borne infectious diseases simply because abatement programs are not as effective. But absolutely, the vector management programs at the county and or state level have been instrumental in controlling human outbreaks of these, potentially deadly and devastating viral infections.
Absolutely. Yeah, thank you for sharing that information, Dr. Rayner. Are there any other resources or preventive measures that you would recommend people who would like to look more into this issue check out?
In addition to abatement programs and minimizing the breeding sites on your properties, mosquitoes are most active at dusk and dawn, so avoiding activities during those periods of the day, and also using repellents or something to that effect, to minimize the mosquito bites. Those practices can all be implemented to help prevent the risk for mosquito-borne infectious disease transmission.
Because essentially you can't get a mosquito-borne disease if they can't bite you, right?
Exactly.
Awesome. Well, thank you so much, Dr. Rayner, for joining us. I, for one, learned a lot, especially about abatement. It's good to know that that's being addressed in the community. And thank you, everybody, for listening. So please tune in next time for another episode of Standard Precautions and Beyond, Conversations in Infection Prevention and Control.